Good evening. I'm Linda Fegler, AARP Ohio volunteer, and it's my pleasure to welcome you to Wellness Wednesday. Our topic this month is healthy sleep, and we are pleased to be joined by Dr. Nancy Foldvary-Schaefer. She is the director of the Sleep Disorders Center at the Cleveland Clinic, and she's also a professor of medicine at the Cleveland Clinic Lerner College of Medicine at Case Western Reserve University. She has treated patients with sleep disorders and epilepsy at the Cleveland Clinic since 1995, and she served as a lead investigator on numerous clinical trials and has published on sleep and epilepsy, epilepsy surgery, EEG, women's issues in epilepsy, and sleep disorders. Welcome, doctor. Thank you for joining us tonight.
Thanks for having me.
Thank you. And I think you have some slides to share with us.
Yes, I think, here we go. Well, it's my pleasure to be here today. What I thought we'd do is start with a brief presentation that summarizes some of the most important and general aspects of sleep medicine. So next slide, please. Sleep disorders are very common. We believe sleep disorders affect about 70 million people. And when we talk about sleep disorders, most people think about insomnia, when you can't sleep, or breathing disorders like sleep apnea. But there are 6 others, including disorders of hypersomnia, where people are excessively sleepy, movement disorders at night, parasomnias, which are things like sleepwalking, abnormal behaviors during sleep, and then circadian rhythm disorders, which are disorders of the timing of sleep. And collectively, these 6 categories have 80 sleep disorders that can be diagnosed. Unfortunately, many doctors have not been trained in sleep medicine, and so many people are undiagnosed. Many people come to see us in the sleep disorders clinic and have diagnosed themselves. Next slide. So several years ago, Fitbit conducted the largest sleep study ever. If any of you have had a sleep study, you know it's an overnight test, usually in a sleep lab, that's very labor intensive. Well, Fitbit took millions of nights of data from Fitbit watches and analyzed these data to get some big data, so to speak, big information about large populations of people. And I'll call your attention to the top right that says that the average time of sleep of these thousands of people, was 6 hours and 38 minutes, which you'll see is very short. Next slide. So further, this Fitbit study showed that different generations sleep differently. And in fact, while the youngest of our adults and older teens go to bed the latest, they also probably get the most sleep. And as we get older, our sleep changes. We tend to go to bed earlier, but we also tend to get less sleep. And sometimes that less sleep reaches a lower limit, which is abnormal. Next slide. And it turns out that 40% of adult Americans cut their sleep short. Next. Here we see on the bottom, average hours of sleep over time. So the first column is 1942. Back in the 40s, adults in the United States were sleeping about 8 hours, which was normal. That was good sleep. In fact, before the invention of the light bulb, adults in this country slept 9 hours, which is even better. But as you can see in the last few years, sleep duration has declined, and it's staying on average under 7 hours, which is not healthy for our society. Next slide. This is a graph of data from the CDC that estimates healthy sleep. So the different colors represent the various states in the United States where various percentages of people are at least sleeping 7 hours. Next. So you see in Ohio here, the little red star in Ohio, we are one of the states in white. The white states are states where no more than 56% of adults are getting enough sleep. We are living in a sleep-deprived state. Next slide. One of the most common consequences of sleep disorders is excessive sleepiness. So this is the inability to stay awake or alert during major waking period, and this can result in unintended lapses. It's the cause of many motor vehicle accidents. And one recent study estimated that among 16,000 adults in the United States, 27.8% of them had excessive sleepiness. Excessive sleepiness is associated with a host of bad health and social consequences. So we know that excessive sleepiness is associated with psychological distress, anxiety, underperformance in school, underperformance on the job, and of course, poor performance behind the wheel. We also know that excessive daytime sleepiness is associated with a host of medical and psychiatric disorders, but is made significantly worse in people with mood disorders, that's depression, anxiety, as well as substance use. That includes sleep aids and alcohol. Next slide. So this is a summary of just the most common and maybe the most important health consequences that are linked to insufficient sleep. And insufficient sleep could be an inadequate amount of sleep or poor quality sleep. So we've known for many years that weight gain and obesity, diabetes, these are metabolic disorders, are associated with insufficient sleep. We also know that a variety of heart diseases, including cardiac arrhythmias, heart failure, and heart attacks, as well as high blood pressure, occur more frequently in people who have inadequate sleep than those who sleep well. And for many years, we've known that insufficient sleep and sleep disorders can cause stroke, depression, impaired immunity, even increased risk of death. Next. But what we've learned in the last few years, which is very compelling research, is that insufficient sleep and sleep disorders like sleep apnea are associated with cognitive impairment. Literally, obstructive sleep apnea untreated is associated with the development of Alzheimer's disease. And so it's just critically important that as a society, we work to getting adequate sleep. Next slide. So this is a graph that may be a little busy, but I'll walk you through it. On the left vertical axis, we have performance. And on the horizontal axis on the bottom, we have hours of sleep. So going from left to right, we've got longer hours of wakefulness, longer time from the last time someone slept. And then on the right side, we have blood alcohol concentration. So this is a study that really is a classic sleep research study. It was conducted in young men, maybe in their 20s. And these men were subjected to an experiment where there were two conditions. The first was they had to stay awake for 28 consecutive hours. And every hour over that 28-hour period of testing, they had to do, they were tested to measure how well they performed. And that's what really we're measuring in this slide. Once they finished that part of the experiment, they had a break and then flipped to another experiment, which was consuming alcohol at a steady pace every hour until they had a blood alcohol level in the range of legal intoxication. And what this slide shows off to the right is that performance goes down when people have wakefulness, when people are awake for 17 hours or longer, and that is comparable to having a blood alcohol level of 0.08 or 0.1, which means that when we're awake for 21 straight hours, we perform no differently than if we were legally intoxicated. Next slide. Now that was an extreme sleep deprivation experiment. This is a situation that may be much more realistic to you. This is a study that measured motor vehicle accidents surrounding daylight savings time. So on the left, we see the spring shift. So when we spring shift forward, we lose 1 hour of sleep. And then when we have the fall shift, we move 1 hour back and we gain that hour. So this was conducted in Canada. And this is literally all of the motor vehicle accidents in the entire country of Canada on the Monday before daylight savings time, the Monday right after the shift, and the Monday the following week. And what you see on the left is this huge peak in the middle. The light bar in the middle is a huge increase in motor vehicle accidents after losing just 1 hour of sleep the Saturday night before. And on the right, we see a significant reduction in motor vehicle accidents just by getting 1 more hour of sleep. So this illustrates a number of things, but most importantly, that very small amounts of sleep loss can have really devastating consequences. And this is particularly important for people who are vulnerable to sleep loss. As we get older, our systems are less able to accommodate these kinds of shifts in our sleep schedule. And so with advanced aging and with shift work, these are things that really can cause accidents and injuries. Next slide. This slide is from the AAA, and it summarizes car crashes that involve drowsy drivers over a period of 5 years in the United States. So what we're seeing in the red bar are the percentages of people who had the event on the left as a result of drowsy driving. So in other words, 6% of all car crashes were attributed to drowsy driving. 7% of all crashes that led to an injury were due to drowsy driving. 13% of all accidents that led to a severe injury were due to drowsy driving, and 21% of fatal car crashes were due to drowsy driving. So this is one of the most horrible consequences of sleep deprivation, and it's absolutely something that as a society we can manage, but it requires a lot of education, and it requires that people start to really protect and value their sleep. Next slide. Okay, this may be my most favorite slide because I'm a neurologist, and these are pictures on the right of a PET scan, which is a way that we image metabolism in the brain. And essentially what's happening here is that you see 3 columns, the first 3 columns and that are in color. The first are normal sleepers. The middle column are people who are sleeping a little sort of intermediate, a little less than normal, 6 to 7 hours. And the third column, where you see all the orange, are people who are sleeping consistently less than 6 hours or less. The orange that you see deposited in the brain is beta amyloid. That's the protein that causes Alzheimer's disease. So among much research going on in the sleep world, one of the most important discoveries that initially was reported in 2013 and since has evolved into a huge field of research is that sleep serves an active function. When our brains are sleeping, this toxic protein is getting cleared out of our brains. If we don't sleep, that toxic protein can accumulate in our brains. Next. So in the same year, in 2013, there was an equally important study done in mice that showed that during sleep, the size of a space inside our brain that allows this toxin to clear increases. So when mice were deprived of deep sleep, they accumulated these neurotoxins, toxins that are abnormal in the brain, toxins that can lead to dementia. When these mice were allowed to sleep, they cleared those toxins. Next. So this led to a dual discovery in the same year and much research ever since, that sleep not only rests our blood pressure, restores every cell in our body, allows our heart to get oxygen, but sleep also eliminates neurotoxic waste products that otherwise would accumulate and lead to brain diseases, including Alzheimer's. Next slide. So a few years ago, the National Sleep Foundation established new sleep duration recommendations, and the arrow is pointing to the amount of sleep that middle-aged adults should get. This is a broad range because there's the genetics that each of us have dictate to some degree how much we sleep. And so the average adult healthy sleeper is sleeping from 7 to 9 hours. There's some variability there. There's 1% are shorter sleepers, 1% are longer sleepers. And then as we get a little bit older, into the 6th, 7th, 8th decade of life, average sleep duration is more like 7 to 8 hours, because as we get older, even people who could sleep longer when they were young usually are unable to sleep long anymore. So, but the common theme here is that at least 7 hours of sleep is recommended. Next slide. So for that reason, and due to the fact that over 80% of people with common sleep disorders like sleep apnea are not diagnosed, which is striking considering that the field of sleep medicine has existed since the 1970s, and so many people are unaware of these disorders. So many doctors are really not adequately aware of these disorders. At the Cleveland Clinic, we created a program with a sleep app. It's a mobile app for iPhone users, and our hope was that we can use technology to reach more people, to educate them about the fact that insufficient sleep, which affects 40% of us in the United States, leads to so many adverse consequences. Again, motor vehicle accidents, accidents on the job, cognitive impairment, sleepiness, depression, substance abuse, heart disease and stroke, and metabolic disorders, as well as early mortality. The cost of insufficient sleep has also been estimated, and the cost of insufficient sleep in the United States is believed to be above $400 billion a year. It's really astronomical. One sleep health program that was conducted actually in Columbus in a fire station found that simply educating firefighters and providing some access to resources for sleep therapies reduced disability days by 46% and saved one fire station over $2 million a year. So there's clearly health and social benefits as well as financial benefits to big organizations who care to add sleep wellness to their wellness programs. Next slide. And here is the sleep app. If you have an iPhone, you can download this by going to the App Store and searching for Sleep by Cleveland Clinic. On the right, you see a dashboard. Our sleep app allows people to screen themselves for sleep apnea, for insomnia, for sleep duration, as well as for shift work. Shift work sleep disorder is also a grossly underdiagnosed disorder. And the app will give you scores that you can share with your doctors, as well as allow you to click the arrow on the right for more information. And next slide, and that wraps things up. So I'd love to hear your comments and questions.
Well, thank you so much, Doctor. Something we can all relate to on some level. How many hours of sleep do you get a night?
I'm kind of paranoid about my sleep. So yeah, I don't feel well when I get less than about 7 hours of sleep.
Okay.
I mean, I know that I'm not thinking as clearly and performing as well. I can easily get 7.5 to 8 hours every night. And that's what I aim for.
Okay. Is there such a thing as sleeping too much?
There may be. So just as, and this is a great question actually, just as short sleep, less than 7 hours, is associated with health hazards, long sleep is also associated with health hazards. Now, some people who are sleeping long have sleep disorders that cause them to sleep long. So those people need to be diagnosed and treated. But other people who sleep long without sleep disorders may be depressed and maybe using over-the-counter medications and be on substances that are extending their sleep, or may be afflicted with other medical problems. But there is some data to suggest that people who sleep 9 hours or more on a regular basis probably also have a shorter lifespan as people who sleep less. So you want to kind of find that place in the middle, somewhere in the range of 7 to 9 hours, and probably not 10 or 11.
Okay, thank you for that. Let's start with some general sleep questions. Are sleep disorders underdiagnosed, and what can patients do about that?
Yes. Yeah, so sleep disorders, almost all sleep disorders are underdiagnosed. And this is, as I alluded to, this is probably largely because sleep is a young field. So, relative to cardiology or neurology, sleep programs really didn't start to develop until the 1970s, and they really didn't grow well in the United States until the 80s and 90s. So we're a young field, but also primary care doctors, general internists don't have to have any sleep education when they're in training. And for docs who are, in their 50s, 60s, sleep medicine really didn't exist as a field when they were training. And so many healthcare providers are just not really adequately trained to help people recognize these. So yeah, we suspect that 80% of obstructive sleep apnea is undiagnosed, despite the fact that there are sleep labs pretty much in every city in the United States. People can talk to their doctors about sleep. Don't forget to bring up sleep when you see your doctor for your regular visit. And people can use our sleep app or find many other apps or questionnaires online and read about common sleep disorders like sleep apnea. See if you think you qualify for a sleep study and call your doctor.
Okay, we have a question that came in from a listener. They'd like a recommendation for waking up without headaches when sleeping with an ergonomic pillow. And is there a way to be able to have healthy sleep without using medications and avoiding alcohol? Is there a way to do that? Should those be avoided, medications and alcohol?
Yeah, so alcohol is really not good for sleep. Alcohol does a number of things. First of all, alcohol is the most common thing people use in the United States to get to sleep, but alcohol metabolizes within a couple of hours. So it leads to very fragmented sleep for the rest of the sleep period. And it's going to reduce your chance of getting into deep REM sleep, REM sleep, or dream sleep. And we need REM sleep for brain health. So we don't want to be drinking at nighttime and losing out on REM sleep. In addition, alcohol makes the throat muscles really weak, so it can make sleep apnea worse. In terms of headaches, that's a complicated question because there are many different headache disorders. There's actually a disorder called sleep apnea headache. People with sleep apnea often wake up in the morning with headache, and it takes a few hours to shake off the headache, and that's because they spent so much time during the night without good oxygen. So I think if you're waking up often with headache, it's worth talking to your doctor about, because most likely you either have something happening during your sleep that's causing headache, or you're trapped in that cycle of headache and poor sleep that a lot of headache patients are in.
Okay. And when some of us reach a certain age, we find ourselves having to use the bathroom every several hours overnight. That clearly affects sleep because we're waking up, getting up, coming back. Is there any way we can improve our sleep for those of us who find ourselves doing that?
Yeah, that's a tough one. Most of the time, the patients I talk to about that really, I have prostate problems. They kind of have to get up and use the bathroom, but it's also important to really protect your sleep environment. So when we get up at night, it's easy to go to the bathroom, go get something to drink, go get something to eat, put the light on or whatever. It's really, try to avoid doing the things that are going to further disrupt your sleep. There shouldn't be electronics in the bedroom. Lighting, it's really important that lighting is good, that the mattress is comfortable, that the temperature is at a good temperature to promote good sleep. Most people who get up and go to the bathroom because they need to clear their bladder go back to bed and within 5 to 10 minutes are sleeping again. That is normal. If you're laying in bed, tossing and turning, thinking about what's on your mind for more than 20 minutes, you should get out of bed and don't get back into bed until you're sleepy, because you don't want to make a habit of laying in bed waiting for sleep to happen. That creates a chronic insomnia problem.
Okay. Is the Cleveland Clinic app free? That's the question someone asked.
Yes, the Cleveland Clinic app is free, but it's only for iPhone users. So unfortunately, right now, the current app is only available if you have an iPhone. If you have an Android, we haven't yet developed that version, but it is free.
And speaking of phones, at night, we should leave the phone off and out of the bedroom, right? Because, if we get up, we're going to look at it, right? There's no way around. Okay.
Yes, and so, cover up your digital clock and do what you can to minimize disturbances so that you can really protect your sleep.
Okay. One listener says, I fall asleep fairly quickly, but then wake up 2 to 3 times a night. How can I mitigate this?
Yeah, so this is a very common question that we see in the sleep clinic, and this is the job of the sleep doctor, figure out why you're waking up at night. Very often it's sleep apnea. So even people who don't snore, or don't think they snore, or don't snore loudly or consistently can still have sleep apnea, and that's a common cause of awakening. But there are other things. There are leg movement disorders that people can have. Restless leg syndrome, which is a disorder where the legs feel like they need to move in the evening time. That can be associated with leg jerks that can wake people up. And then there are other medical problems like reflux. You know, when you have acid reflux, that tends to cause awakenings, and some people don't even have that acid taste in their mouth. And finally, caffeine. So caffeine lingers in the central nervous system far longer than you'd think it does. So if you're having trouble sleeping, it might be good to try no caffeine for a few weeks and see if that solves the problem before you call your doctor.
And you're right about that acid reflux because oftentimes you don't get the heartburn. It's a whole other symptom. So it may take
Right.
a time to diagnose, but you need to check that out as well. Another question. If I wake up every night around 3 a.m., does that reset the stages of sleep? Or are they tied to the time of night? For instance, REM sleep occurs between 11 a.m. and 5 to 1 p.m., et cetera. Are there specific times for these sleeps?
That's
So,
a fabulous question. Yes and yes. So in other words, when you wake up in out of at 3 a.m. out of REM sleep, and then you've got to go back to sleep, your brain does need to kind of descend back into through the light stages to get back into REM. So there's a little bit of that, but probably more importantly, the circadian time, the clock time of where you are will drive whether you get into REM sleep or non-REM sleep. So between the hours of 2 and 5 a.m., we spend a lot of that sleep time in REM sleep. So it's both timing and it is the descent back into sleep. And this is one point that's really important for shift workers. Third shift workers who sleep during the day do not have normal sleep physiology because our brains are wired to sleep at night. And so they are often chronically sleep deprived, and they're deprived of deep stages of sleep that are really important for heart health and for brain health.
now, if you wake up and then go back to sleep, you don't pick up where you left off, right? You're starting again with the first turn of the cycle, right?
You're starting again, but it's going to be a quick
Okay.
descent into REM. You're going to get into REM really quick, but you will go through the light stages first.
Okay. We have another question here. How can occupational therapists help their patients with sleep disorders or who suffer from poor sleep improve their sleep? Anything that therapists can do. That's from Katya.
Occupational therapist, that's interesting. So I would think, many people are affected with pain, body pain, muscle pain, neck pain. And clearly, one of the things that disrupts sleep more than anything is our pain disorders. So getting people comfortable, getting a pillow with the right neck alignment is really important. And all providers, whether you're a doctor, an occupational therapist, a nurse, certainly could reiterate to people that it's critically important to get 8 hours of sleep. Sleep is like exercise and diet. You can't have two of those without the third. If you eat well and you exercise but you don't sleep, you're not going to have normal metabolism, and you're not going to perform well when you're exercising. So you really need all three.
Okay. And you mentioned the right pillow. How do you know how to, any tips for that?
Yeah, this is tricky, and I think every year we get a bunch of phone calls in our sleep center from pillow companies asking, to do research and endorse it. I think that it's just so individualized. So for me personally, if I'm not sleeping on a memory foam pillow that has a lot of support for my neck, I will wake up in the middle of the night with a headache, and I'll have a headache most of the day, and I'll have poor sleep. Other people will say the pillow makes no difference. Some people need to sleep in a recliner because they just have cervical spine, like arthritis in their neck, and they can't get comfortable in the bed. So the key is finding what works best for you and sticking with it.
Okay. Is it good to take naps during the day? I mean, that's something we all think about. Should they be 20 minutes, 90 minutes? And do they throw off your sleep cycle at night?
It really depends on what kind of a sleeper you are.
Okay.
So people who are insomniacs, people who are already having trouble falling asleep or staying asleep, really should avoid naps, because in a nap you're going to sleep off some of that sleep debt, and you will then have more trouble sleeping at night. However, there are many people who sleep well at night and just enjoy a nap during the day, or feel sleepy during the day and get refreshed by a nap, and that's perfectly fine. I would limit daytime naps to no more than 60 minutes, because longer than that, you're getting into deep sleep. And when you're in deep sleep, it's hard to wake up. You have that sleep kind of drunkenness kind of feeling. So probably no more than an hour, and only if you're not someone prone to insomnia.
Okay. Is there a problem with taking too much melatonin, and how much is too much? Asked Jan. Or Jane. Sorry, Jane.
These are great questions. So melatonin, there's a bit of a sort of some fallacies about melatonin. Melatonin is a hormone that we actually get in our brains, but some people don't get enough of it. So we're taking a lot of melatonin these days. Melatonin helps to change the timing of sleep. So if you're a shift worker, melatonin can help you sleep when you need to sleep. If you're traveling across 5 time zones, melatonin can help you shift your sleep time so that you can function when you're off in Europe on a vacation. Melatonin's never been demonstrated to be a good sleep aid for the person with insomnia. So I think it really depends on what you're taking it for. For people who are shift workers or taking it for jet lag, you only need 1 milligram. In fact, more than that is harmful. For people who have a disorder called REM sleep behavior disorder, where they act out their dreams, they may need 20 milligrams. But for the average person with insomnia, I wouldn't go above about 10 milligrams of melatonin. And if it doesn't help, I would come off of it. Don't keep taking it, because there's really no scientific evidence that melatonin helps to improve sleep if you have insomnia.
Okay. Can you revisit any information you provided about how much deep sleep a person needs each night?
Yes. So I didn't get into much detail there, but we have non-REM sleep and we have REM sleep, and we spend about 20% of our sleep time in REM. And most of that REM time comes at the end of the sleep period. So if you wake up with a headache at 3 a.m. and you can't get back to sleep, you are probably going to get deprived of REM sleep, which is not a good thing for your brain. On the other hand, deep non-REM sleep happens in the first third of the sleep period. Deep non-REM sleep is the stage where people will sleepwalk from. So sleepwalkers tend to do it within a couple hours of falling asleep, not in the early morning hours. Deep non-REM sleep is equally important. It's important for memory consolidation. It's important to restore every cell in our body. So we need both non-REM deep sleep and REM sleep. One is not more important than the other. They're complementary. And to get both, we really need to be in bed long enough and sleeping long enough. We go through 4 or 5 sleep cycles a night. So when we're cycling, we're going to get a lot of non-REM in the beginning, and we're going to get a lot of REM at the end. So you just need to be in bed up to 8 hours in order to really optimize the amount of deep sleep that you're getting.
Okay. You mentioned sleepwalking. A lot of comedy shows are done about that, but it really is no laughing matter. Is that common, and what causes that?
So sleepwalking is probably genetic. It affects about 15% of young people, but most kids and teenagers grow out of sleepwalking. Sleepwalking in adults is less common, probably 4%, like 4 out of 100. 4% of people will sleepwalk. Some of those people are genetically predisposed to it. They were sleepwalkers when they were a kid. They're still sleepwalkers. But there are a couple of important things to point out here. One is that sleeping pills and some medications can cause sleepwalking. Ambien can cause sleepwalking.
What actually is it? Is something in the brain, doctor, that causes you to get up and go, or do you know?
Yeah. What happens is that there's an arousal, and part of the brain is awake and part of the brain is still asleep. So while the body looks like it's awake and it's walking or it's driving or it's eating, actually the part of the brain that controls consciousness is still asleep. So our brains, interestingly, are not all awake at one time and all asleep at one time. Our brains are normally a little bit of both, but in the sleepwalker situation, it's it's an extreme situation where the person wakes up and they're really in, their brain is in a state of sleep, but their body is in a state of wakefulness. And so Ambien zolpidem, which is a common sleep aid, is one of the triggers of this. It's not so common, but it's common enough to warn people about it in advance. And there's many other medicines too. Some of the antidepressants, some pain medicines can cause this. So when an adult starts to sleepwalk for the first time in their life, I'm always suspicious that it must be a sleeping pill. There must be a medication that was just added, or this person may be very sleep deprived or very stressed, because those are the triggers of sleepwalking in adults.
If you know a sleepwalker or live with one, is there a way to wake them up to get them back to bed? Is there a way to do that to get them back in the bed? Do you have to wake them up fully, or what would you suggest doing?
Yeah, well, what we suggest is that you don't wake them up fully, because when so sleepwalking is coming from a deep stage of non-REM sleep. And when think about, like, if you're in bed and someone starts shaking you, it's startling. Most people are going to wake up and react in a defensive way. So we recommend that you coax the sleepwalker back to bed, kind of coax them to a safe place, but don't really jolt them or yell, get in their face, because they may react in a self-protective way, and they may hurt themselves or they may hurt you by doing that. Also, some people, so if sleepwalking becomes a regular occurrence, it's important to make your home safe. So I just talked to a patient today who's walked outside, gotten into his car 2 times recently. Fortunately, he couldn't figure out how to start the car, even though he had the keys, so he didn't start driving away. But if you live with a sleepwalker, make sure that you have an extra bolt on the door. Make sure that the windows are locked. When I first came to the Cleveland Clinic in 1995, the first sleep patient I saw in clinic was a guy who had jumped out a 3rd-story window in a dream, and he came in with 2 broken legs. So, I mean, these things, they're rare, fortunately, but these things can happen. So it's important to make sure, if you're a sleepwalker, that you can't leave the house, you can't fall down the stairs, you can't jump out the window. So keep the doors and windows locked.
Thank you for that. We have a question here. Is there a sleep app you recommend for Android users?
Not that I'm aware of. There are many apps. There are many apps. I just don't know what's available for Android users. I think the most important thing is, find information, whether it's on an app or whether it's on, your computer, that allows you that asks questions about your sleep, so that you're allowed to interact with it a little bit. Even on the Cleveland Clinic Sleep Disorder Center website, we've got some questionnaires just on the website, so you can go to your screen and fill in some answers and get some scores. They're not the same ones as the app, but they're close. And so you can find that at many academic organizations. Besides Cleveland Clinic, Mayo Clinic has that, Johns Hopkins has that.
Okay. We have a question about, does a person with tinnitus have less REM sleep? That's from Tina.
Tina, that's a good question. I don't know. Although people with tinnitus are very prone, so tinnitus is ringing in the ears. And some of these disorders of tinnitus are very disabling. I mean, very disabling. When people roll over at night and roll back to the other side, it can activate it, and they can get dizzy and get vertigo. So I don't know of any study that's measured sleep stages in people with tinnitus, but I know just from practicing that tinnitus can disrupt sleep quite a bit.
Mm-hmm. A question from a person who consistently wakes up at 4 a.m. and cannot fall back asleep. Can the doctor recommend any steps they can take to go back to sleep? That is from Anne.
Yes, thanks for that question, Anne. I think that we do have recommendations for this. We call these recommendations usually having good sleep hygiene. So one rule, which may not sound so appealing, but is so important, is to never lay in bed more than 20 minutes tossing and turning. What that does, if you do that every night, it just gets your body and brain used to being in bed awake. So rule number one would be, as painful as it may sound, get out of bed and go read something boring, iron, do something boring for 20 minutes until you actually feel you can get into bed and fall asleep again, and then try again. That's the best rule. Make sure that you don't have electronics in the room. Make sure you're not watching the clock. If this is a chronic problem, ask your doctor for a referral to a sleep doctor, because there are board certified sleep therapists who can teach patients how to sleep well again when they're having insomnia in the middle of the night.
When that happens to me, I usually get up and go to the couch, and then I turn on some true crime show or Columbo. But I find myself falling asleep a lot of times on the couch instead of going back to the bed. Is that okay for those of us who get up? And I mean, how do you know, it's time
tough.
to go back to
bed? It's tough. It's not a horrible thing. If you find that you're sleeping well on the couch and you get the rest of your sleep, that's okay. But most people, when they're sleeping in different places in the house, start to not sleep well anywhere. So I think I'd prefer for you to kind of recognize when you're getting drowsy again and turn off Columbo. Although it's hard to turn off Columbo. Once I start a Columbo, I want to watch the whole thing. But maybe you shouldn't be watching Columbo at night.
Okay.
That's a good one. So really, you really should do something that's not so mentally activating, kind of boring.
Okay.
Just wait it out in sort of a quiet way, as opposed to really getting engaged in something fun, like a good book or a good.
How to wait that out, and even for this person who getting back to sleep at 4 a.m., how she can get into that.
Yeah. So there's a physical aspect of that, and there's a cognitive or mental aspect to that. But most importantly, it's to leave the room and not let yourself lay there. Do not let yourself toss and turn for more than 20 minutes. Get frustrated, get mad, worry about the next day. All of that is the sign of chronic insomnia. So if you do this on a regular basis, talk with your doctor, because there are treatments for chronic insomnia, and the best treatments don't even require a pill. I don't use sleeping pills first. We use therapies, behavioral and cognitive therapies to treat insomnia that really work very well.
Okay. Do you want to mention maybe briefly what a couple of those might be, those therapies?
Yeah, so actually this is called cognitive behavioral therapy for insomnia. And this is given by board certified psychologists in sleep medicine. So these are not the psychologists you go to for stress or depression. These are very different psychologists who are trained in insomnia. And they go through a series of therapies over a period of a couple months to 6 months that include things like, well, what we said, sleep restriction, not letting someone lay in bed not sleeping, tracking your sleep with a diary, and they'll help guide you through how much time you should be in bed, how much time you need to be out of bed. And then the cognitive part of it is sort of redeveloping a healthy relationship with sleep. So some people who are insomniacs think, I'm going to die if I don't get 8 hours of sleep. It's going to hurt me, and they really get obsessed and very concerned, worked up over it.
You're awake thinking about the fact you're not going to sleep.
Being worked up at night about sleep is only going to keep you awake. So if this sounds like you, I would, contact a sleep center and see if you can find a behavioral sleep medicine provider. The Cleveland Clinic created a computer program that you can do on a laptop or a desktop that's called Go to Sleep. You can purchase it from the wellness website at the Cleveland Clinic. I think it's $40. It's lifetime membership, and it's taught by the head of our behavioral sleep medicine program. So if you don't feel like talking to a therapist, or can't get to a therapist, or can't find one, you can buy this program, and you can take your time over a 6-week period and work through this program. And this program will get you better sleep.
We have a question from Taronda. She underwent an overnight in a facility sleep study and have an upcoming follow-up appointment. In addition to being told that she has sleep apnea, she's getting up to 3 to 4 times. She's getting up 3 to 4 times a night because she has an overactive bladder. Many of us can relate to that. She is working with a urologist to identify the right beta blocker medication. She plans for 7 to 8 hours of sleep, but suspects that with sleep apnea and disrupted sleep, she probably is getting much less sleep. Based on what she shared, would you agree with that?
Yes, you're probably getting much less sleep. Now, treating the sleep apnea will likely deepen your sleep. And if your sleep is deepened, you may not wake up as many times needing to urinate. So if you have an overactive bladder and every time you use the bathroom, you're sort of not voiding very much, it's small amounts, you may really benefit just by having your sleep apnea treated, because that will make it harder for your bladder to wake you up if your apnea can be treated.
Now, it used to be to get the test, you'd have to go to the Marriott at West 150th, stay in the hotel, have people watch you, and that was not something many of us were particularly interested in doing. But I guess there's many other treatment options here. And also, what do you wear? I mean, it's no longer just that Hannibal Lecter-like mask with the cord that makes the noise, right? There's other options here now, right? Not only for testing, but also for treatment.
Yeah. So for testing, we still do sleep lab studies in the sleep laboratory, and most of our labs in the Cleveland Clinic system, we've got 7 of them in Cleveland, and there's others in Akron, are in hotels. They're nicer than basement sleep laboratories in the hospital, but they do require hooking up to a bunch of wires. That test gives us a lot of information. However, for the person who is very likely to have sleep apnea, and we're not concerned about measuring any other thing, they might qualify for having a home sleep apnea test. So these are tests that are done overnight, but in your home. In the Cleveland Clinic, we send these to people's homes so they don't have to come to the hospital to pick up the recording device. And it comes in a package with information about how to hook up the sensors. There's just a sensor under your nose, one by your mouth, one over your chest and belly, and a fingertip oxygen probe. So it's really easy. And you can do that in the comfort of your own home. And that may be a good enough test for sleep apnea. In terms of treatments, CPAP still has lots of benefits. There are many types of positive airway pressure machines. It's not all just CPAP. There's CPAP and BiPAP and auto and this and that. So there are lots of different modes that are helpful to make people comfortable using that. But in addition, oral appliances that are made by dentists that advance the lower jaw forward are very effective for mild sleep apnea. And going back a few years ago, the FDA approved the first implant. It's called hypoglossal nerve stimulation, or Inspire therapy. You probably maybe saw the Inspire commercials on TV. This is a device that's implanted under your clavicle in your chest. It connects to the nerve that forces your tongue open. And when you turn your device on at night, which you can do yourself with a magnet, it creates space in the back of the throat by advancing the tongue forward in the mouth. So this is called Inspire therapy. It's a form of neuromodulation, meaning we're modulating a nerve that controls your tongue muscles. And in so doing, we're creating an opening in your throat to treat your sleep apnea. Very effective, but there are certain criteria to qualify for it.
Is there one test that's more effective? Would the sleep lab be the ultimate? Or would you not recommend, but is there one that's more effective than others? And also the treatment, is there a treatment that's more effective, would you say, in your experiences? Or
yeah. For sleep apnea, it really needs to be tailored, but clearly the most data we have is on PAP therapy, CPAP. CPAP's been out since the 70s, so we've got beautiful big studies on CPAP. We don't have the same quality of studies for the other therapies, but that doesn't mean they're not effective. It just means that we don't have big trials to share with people. So if you were recommended CPAP and you can't tolerate it, you should talk to a sleep doctor and find out what other therapies are right for you. In terms of the testing, the in-lab test measures about 30 things. It measures your carbon dioxide, your oxygen, your sleep stages, your leg movements. There's a lot of information we get with an in-lab study. Unfortunately, some insurance companies will not pay for them. Unless if there is a super indication, unless if there's a really unique sleep problem, or a person had a home test that was inconclusive. The home test didn't get the answer. then they'll allow you to come to the sleep lab. So I would always prefer the in-lab test, but the home test is adequate in some people.
Okay. We have a question from Doug. Devices like Fitbit or Apple Watch measure sleep quality. How accurate are those measurements?
Great question. So, Fitbit and Apple, they're very interested in this. I'm sure they're going to develop the next version of a sleep study and put us out of business. But their data links or is correlated rather weakly with in-laboratory sleep testing. So you can learn a few things from your Fitbit, like maybe how many hours of sleep you got, but you can't diagnose a sleep disorder with a Fitbit. I watched my Fitbit once when I was having a recording, and my Fitbit estimated that I was spending so much time in REM sleep when I didn't have REM sleep. So, these are just technologies that are evolving. They'll probably get better and better, but I would not rely on a tracker, a wearable right now to make a sleep disorder diagnosis yet.
Okay. And also he asked, is there any connection between daily exercise and sleep quality?
This is another good question, and we don't have good studies on this, but healthy sleepers will often tell me that they exercise every day and in the morning. Certainly don't want to exercise rigorously within a few hours of bedtime, because exercise, gets all the hormones, epinephrine going in your brain, and it can be a while for that to damper down before bedtime. But regular exercise, it's kind of like regular exercise, healthy eating, get you healthy sleep. Those three things kind of track together.
One of the issues that AARP focuses on is caregiving. And a recent study showed that 94% of dementia caregivers are sleep deprived. What effect, doctor, can this have on their own lives and caregiving? And also, how can they manage their insomnia if they have it?
Yeah, this is very important. So caregivers of all types become sleep deprived. There's no doubt about it. And caregivers of people with dementia probably have the toughest time because caregivers have to be patient, right? You've got to be cognitively intact. You've got to have a good mood, and you've got to have the physical energy to do what you need to do. And all of those things require 7.5 to 8 hours of sleep. So I think that's just very difficult. Following some of the basic sleep hygiene rules would mean that you really need to be in bed yourself for 7.5 to 8 hours. And if you're caregiving someone who is up in the middle of the night, and you need to perform all day, there just aren't any magic solutions to getting sleep. But a few things. I would avoid over-the-counter sleep aids, because things like Benadryl have been studied in older adults, and they hang around in the central nervous system for hours the next day. So I would avoid things like over-the-counter sleep aids. Obviously avoid alcohol. See if you can exercise a little bit and have a little bit of private time to keep yourself sort of mentally well, and really aim for 7 hours of sleep, even if it can't all be acquired at night, even if it means some daytime sleep.
Okay.
And I know I'm saying those things, and many people just couldn't do those things. It really is a big challenge.
Well, also the other side of the equation is, since sleep is so tied to overall mental and physical health and wellness, how can caregivers make sure their loved one is getting sufficient sleep?
Yep. Treating patients who are older, particularly with dementia, is very difficult. I must say that now that we know this link between dementia and sleep apnea, we're seeing more and more patients come to the sleep center with dementia, and they're very difficult to treat. Sometimes we use different kinds of sleeping pills, not really sleeping pills, but psychiatric pills that can promote sleep to both quiet mood and quiet hallucinations, but also induce more sleep. And sometimes using those medications can help a demented person wear a CPAP machine, which is very difficult for people with dementia. There's some new studies with alternative therapies for sleep apnea. There might be a study with the stimulator for demented patients. So clearly, dementia is a common thing. We are living longer in our country. We live longer than we did 100 years ago. And so there's more prevalent dementia, and there needs to be more research on how dementia people demented patients can sleep better.
And there's also many shift workers these days, and it amazes me how that people can transition from one, around the clock, different sleep times. Is there a shift worker disorder, and are there any options for people who have to be on that shift? What's the best way to get that sleep?
There is shift work sleep disorder, and it's probably the least known sleep disorder, but probably one of the most common sleep disorders. So this is a disorder when you're a shift worker, whether it's third shift or rotating or second. If you have a sleep disorder that forces you to sleep outside of the time frame that is normal for your brain, and you have consequences as a result, like you're tired or you're sleepy, you have shift work sleep disorder. So there are a number of things. First of all, there are a couple of FDA-approved wake-promoting medications that we can prescribe for shift work sleep disorder. These medications don't treat the problem, because the problem is that you're forced to sleep when your body doesn't want you to sleep. And you're forced to be awake when human beings should not be awake. But they treat the symptoms of severe daytime sleepiness so people can work in a safe environment. We also use low doses of melatonin that needs to be timed very carefully, and light therapy when you wake up, whenever that is, in the morning or at night, whenever your wake up time is. Sitting in front of a light, those lights, they're called like happy lights or sunlights that people use for seasonal affective disorder, is very wake promoting. So those are generally the therapies. And very often I help patients talk to their employers to educate employers about the hazards of third shift work. There's new data that suggests that third shift workers are at risk for cancer. I mean, not sleeping during the regular hours when our bodies were born to sleep is not healthy. And so cancer is perhaps the most horrible manifestation that someone could get after a period of many years of shift work.
Wow. Are there some other things that people are kind of attributing to shift work as well? Other health issues?
Probably shift workers. Clearly, shift workers are high risk for mood disorders because they're not sleeping. Anxiety, depression is very common. Clearly, shift workers are substance users. They're using alcohol, they're using Benadryl, they're using anything they can use to try to get themselves some sleep. And those things obviously don't work, and they can lead to substance abuse. And also, there's a suspicion that shift workers have more likely to have hypertension and heart disease because, again, they're not getting deep stages of restorative sleep. If you sleep 7 hours during the day, that's great if you can do that, but it's not the same 7 hours as if you were sleeping at night. You're probably not getting the same percentages of deep sleep, and every cell in our body needs deep sleep.
Okay. We have a question from Jane. Can you discuss the efficacy of using a pure sleep mouthpiece?
So I assume what you mean, Jane, is an oral appliance of some sort, like a bite and boil device.
Okay.
These things that you can buy. These are things that are generally very effective for teeth grinders. So that's another sleep disorder. People who grind their teeth can really wear down their teeth. So those devices are not the same as the oral appliance for sleep apnea. And so they probably work just by preventing wear and tear on the teeth if you grind a lot, but they're probably not going to help you get better night's sleep or treat your sleep apnea.
We have a question from Mary. Should a person see a pulmonologist or a sleep doctor after an apnea diagnosis? Pulmonologist or a sleep doctor?
Yeah, okay. So sleep doctors in the United States can be pulmonary doctors, can be neurologists like me, can be internal medicine, family medicine, psychiatrists, even ENT surgeons can be sleep doctors. So a sleep doctor certainly can manage sleep apnea. You may know of a pulmonologist who's not specialty trained in sleep medicine, but is comfortable treating sleep apnea because it's a breathing disorder. So as long as the person has experience, if they're not certified in sleep medicine, they still may be a fine doctor to see for sleep apnea. But if you have a complicated sleep disorder, it might be best to see a doctor who's trained in sleep medicine.
Okay, and our final question for tonight is from Joanne, and that is, what effect does meditation or yoga have on healthy sleep?
Well, these were great questions tonight. So we don't have a lot of data on this, but it seems that yoga and meditation are very helpful for sleep. In fact, the part of cognitive behavioral therapy for insomnia is progressive muscle relaxation and meditation. So that's one of the components of CBTI for people with insomnia. But I believe that yoga, meditation are healthy, good practices for everybody. And so even if you're a good sleeper, those practices are probably helpful in keeping you a good sleeper. We don't have a lot of data, but clearly for people with insomnia, meditation is excellent.
Okay, well, doctor, thank you so much. I think all of us will get a little better night's sleep tonight, either because we're doing the right thing or we know what to take the next step to making our sleep better. So thank you so much. Thank you for joining us tonight. Our next Wellness Wednesday will be August 25th, and the topic is managing Parkinson's disease and caregiving for loved ones with Parkinson's. For AARP, I'm Linda Fegler. Have a good evening. Thank you, doctor.